Hello, everybody. We're going to be taking a look at the different topics we have with blood. And this is kind of a cheesy little slide, I know, but we have all these different conceptions about blood and that. And so in this chapter, what we're going to be taking a look at are five primary things that you're going to be discussing. I don't know if I'd call them true essays. A lot of it's going to be just listing. And you can notice that there are 6 things here, but this last item is the lab practical portion. You're going to be looking at some white blood cells, and you're going to be identifying them just by sight. And we'll be doing this in lab, so you get some practice with it. Okay, so taking a look at the different topics here, you're going to be looking at hematocrit. We'll talk about that in a second. We'll be looking at blood types and what that means and who you can donate to and receive from. We'll take a look at white blood cells. Those soldiers, if you will, of the entire immune system, where they're going to be going and seeking out different things. We'll look at what they, how to identify them, what they do normally, and what we call a differential count, which is taking a look at what happens if you have too many. What could that suggest? We're going to look real briefly at blood pressures using a sphygmomanometer and the EKG, otherwise known as an ECG. Okay, and that's just taking a look at heart rate monitors and what's going on there. So that's what you're going to be talking about in this particular chapter. So let's get into it. The first thing that you do when you go into the clinic, you feel kind of crappy, and you just they do a blood draw, and so they do all those weird things, and they take some blood, and then they send you home, and then a little bit later they call you up and they say, yeah, we took a look at your blood, and guess what? We think you're sick with something, so we need you to come in and give some more blood or run some more tests. So here's what they did with that first sample. It's called a hematocrit. They take a sample of your blood, they put it into a vial, and they spin it really fast with a centrifuge. And so when they do that, it's just like on, carnival rides and things like that. When you spin really fast, the things with the most density fly to the outside, and that's how they have this angled. Well, your blood consists of 3 components. We have the plasma layer up here. We have this middle layer, which is actually your white blood cells, and then we have this bottom layer of the most dense stuff, and that's your red blood cells. Okay? Now, you notice that most of your blood, a little bit over half of your blood, is this plasma, what we would call the matrix of your tissues. And so the plasma is about 55%. Your red blood cells, which is responsible for transporting oxygen and carbon dioxide, that's about 45%. And trapped in the middle, it should normally be less than 1%. That's your white blood cell and platelet concentration. Okay, so that's what we refer to as the Buffy coat. So real quick diagnostic, they spin your blood really fast and they look how thick is this layer. If this is more than 1%, say it's 3%, 5%, whatever, if this is definitely more than 1%, what that suggests is that your white blood cell count is high, suggesting that your immune system is fighting something, suggesting that you're sick with something that your immune system is tackling. Then they bring you in to take a look and see what exactly is it fighting. Okay, so it's just a quick thing, hematocrit. This is just a 3-point little, not even really an essay, just kind of a listing. They take a sample of blood. They spin it really fast. They separate it by densities. We should have red blood cells down here about 45%. The top portion should be plasma with 55%. And trapped in between the two is your white blood cell and platelets. It should normally be less than 1% of your overall blood volume. Okay. If that is greater than 1%, make sure you include this on your essay. If it's greater than 1%, then that suggests your immune system is fighting something, and they need you to come in for more tests. All right. Now, the next thing you're going to be taking a look at, this is the big one, taking a look at your white blood cells, what we also refer to as your leukocytes. Leuko means white, cyte means cell. Okay. So your white blood cells, there's 5 different types out there. And so we're going to be taking a look at those. And this takes a little bit of time to describe, but we want to know not only what they are, what classification they fit under, but we want to know what the normal percent is, which is important because if you have high a percent in something else, we need to know what that increase would indicate. So know your normal percents for white blood cells. Know what a normal, if it's higher than that, what we call a differential count, what that could suggest. What do those white blood cells normally do? And also a visual description of the nucleus. Okay, so that's what you're going to be doing, a listing of those things for each of the 5. Okay, so here we go. Taking a look at the first class, these are what we refer to as granulocytes. The reason we call them granulocytes is because if you look within the cytoplasm here, we see little grains. Okay, so granulocytes, granular cytoplasm. And keep in mind that these are our phils, PHIL. That's the suffix that all of these fall under. So the first example, that's going to be your neutrophils. Okay, we know that it's a neutrophil because in this white blood cell we would see lobes of 3 or 5. And I know the sheet that you usually use for reference is 3 to 5. That's actually a 3 lobes, 1, 2, 3, or 1, 2, 3, 4, 5. And this gets a little tricky to see, is that 3 lobes, is that 4 lobes, what is that? But don't worry, you see grains, you're going to see that your options become very limited, and it actually becomes process of elimination a lot of times. So with those particular white blood cells, what we're looking at with the neutrophils, we said normally 3 or 5 lobes. Okay, the normal percent of these guys is 60 to 70%. So the vast majority of your white blood cells are going to be these. And the reason that we've got those there is because their normal function is a bacteria fighter. Excuse me. So the bacteria fighter is there to, because bacteria can reproduce so quickly, they're going to be there to respond to that right away. Phagocytosis of bacteria. What that means is they go and surround and eat that bacteria. Now, I know this isn't a bacterium here, but it's kind of the same concept where they go. In fact, this is even an amoeba as it's going, but it surrounds it and basically brings it in to eat it. It also releases some antimicrobials to keep the bacteria count down. Now, if you have higher than your 60 to 70%, what that suggests, your differential then, would mean that you definitely have a bacterial infection. So the blood results, they come back, they do all this, and I'll describe that at the end. They'll do all this count, they'll take a look at it, and they'll say, okay, your white blood cell count is up, your neutrophils are high, we're going to give you an antibiotic. We don't know which specific bacteria you might have, but we know it is definitely bacterial, so we'll give you an antibiotic. If they find that this normal percent it's still 60 to 70% or whatever, and you're still feeling sick and so on, they know it's not a bacteria, and so they will not prescribe an antibiotic because it won't do any good for you. Okay, so that's how that works. Now, the next one, notice that it is still a phil. Okay, it's an eosinophil. It's defined as having 2 lobes connected by a thin thread, just like this. Okay, now what these guys do, and this is why I have this, you can see the white blood cells here. These guys normally will take a look at parasites. Okay, so they do that. They'll also take a look and they'll destroy this antigen antibody complex. They'll do some of those things. It might be an allergen. It might be some of those inflammatory chemicals that come in. So that's what your eosinophil does. We only have 2 to 4% of these. Okay, so 2 to 4% is your normal. If you have a higher, say you have like a 6% or 7%, what that differential could mean is a parasite. It could mean some kind of allergy. It could mean a disease of the spleen and or central nervous system, so like meningitis and things like that. So it could be those. Now, it is important to note with this one, it's kind of tricky because it goes through a normal day and night cycle. Think about your allergies. It goes through normal day and night cycles as well. Even phases of your menstrual cycle are going to provide different levels of this. So eosinophils, it's not always 100%. They have to take a look and they might have to do several blood draws to see if there's a fluctuation or whatever. But 2 to 4%, we see 2 lobes connected with a thin thread. And we keep in mind what they normally do and what it could suggest if your percent is higher. Now, the last of the phils, the last of your granulocytes is called a basophil. Okay, this is kind of a tricky little definition because it is either the entire cell is just crammed full of nucleus, it's just little blobs all over the place, or it looks like there is no nucleus at all. Sometimes this is clear depending on how it picks up. Okay, so these are basophils. Very, very few of these. You should have less than half to 1%. Okay, that's a normal cell count. So if you have a 4%, that's really high for a basophil. Okay, what we would normally find with this is these are our histamines. These are our ones, if you, normally we take a look at antihistamines, okay? If you're getting all stuffy and your eyes are running and everything else, you take an antihistamine. You want to slow these guys down. Now, what these do is they kind of read the rest of the body, and these kind of mobilize things. And what a histamine does is it floods the bloodstream and basically floods your tissues with fluids so that the white blood cells can get there faster. Okay, so that's what it normally does. It increases blood flow there. It secretes heparin, which is an anticoagulant. Okay, this is the same thing that leeches would secrete so that the blood doesn't clot when they kind of latch onto you. Okay, so that again, what it does is it promotes the mobility of the white blood cells. Now, we typically don't find these guys high in number. However, if we do find more than 1%, you might have chickenpox, you might have diabetes mellitus. That's that one that requires your the insulin shots and everything else. That's that kind of diabetes. We have something called myxedema or polycythemia. Okay, so you don't have to know all of those, but it's just something that those might suggest. Now we take a look at our last group, the second classification for your white blood cells. They are what we call agranulocytes. So remember granular cytoplasm, but this has the prefix A in front. That means without. So these are the ones that are going to have a clear cytoplasm to them. So a lymphocyte is actually quite easy to see because look at the definition. Most of the cells fill just like a basophil. However, you're going to have one small region that is clear, what I would refer to as kind of a little thumbnail or whatever, a little clear region. See this? Looks like just like a thumbnail because it's clear up on top and kind of darker down here. Look for that clear region, and that's how you know you're looking for a lymphocyte. Now, notice I said we changed the suffix. These are sites. If you have granulocyte, those are your fills. Agranulocytes are our sites. That's the suffix. Okay, so lymphocyte, we see that it has just a blob with just a clear little region of cytoplasm. We should have 25 to 33% of your white blood cells are these guys, okay? So what they typically do is these guys do a whole bunch of stuff. They're really doing a whole bunch of things. They destroy foreign cells. They're going to be the ones that present antigens, so they're going to respond. They're going to be kind of our first responders. They look for things that are don't belong in the body. Okay, what we call the antigens. Okay, and so these are little protein markers on every cell. And if it's something that doesn't belong in your body, it's foreign, these guys will grab onto them. Okay, and so they'll present those foreigners to the rest of the white blood cells, kind of figure it out. What the heck is this? Come take a look, see what we can do. So it kind of coordinates those actions. They're going to secrete other antibodies. They serve in your immune memory. And so these guys are the ones, they're going to be kind of the ones that will be a marker. So if you have like vaccines and things like that, they grab onto it and then they help to remember what is this, and they bring in the appropriate responders for there. Now, if you have more than 33%, say you have 35%, 40%, or so on, this could mean a couple of different things. It could mean that you have a virus of some kind. Okay, so you'd see this if you're in viral. And so again, if you go back to the clinic and you feel really lousy and everything, your white blood cell count is high, and these guys are the ones that are elevated, you're not getting an antibiotic. Antibiotics don't do anything against viruses at all. So, they just kind of say, okay, we're going to wait about a week, see if that helps. Okay. Now, the next thing that it could be is just some kind of other foreign cells. It could be even, something like that. I don't know, some kind of sliver or something even. It could be all of those types of things. The last thing it could mean is also cancer cells, okay? So these would respond. Now, don't get alarmed. If this amount is up, you could simply have a cold because that's a virus. Or you could have cancer that's in there. So it's one of those last resorts. They don't jump to that right away. Now, the last of the white blood cells we want to take a look at is what we call monocytes. It typically has a horseshoe shape. Now, be careful. There's two things here. People sometimes mix this up with eosinophils. First of all, that should never happen because the cytoplasm is clear. Okay, you remember those eosinophils have a grainy cell membrane or a cytoplasm, but these don't. Secondly, you'll see one lobe here, but it is definitely the clear, it's clearly the same width throughout. It's not that little thread connecting. So this is why we know, or how we know we're looking at monocytes. Only 5 to 8% of your monocytes, of your white blood cells are monocytes, okay? Now, what these would typically do is they will kind of differentiate into kind of these big cleaner cells. They're going to break down, they kind of start out in immature forms. They'll specialize a little bit later on. They're going to be the ones that clean things. They're going to break down dead detritus that's in the blood cells. They're going to be breaking down other neutrophils. They're going to be breaking down that pathogen complex. Remember, I just said with the last one, lymphocytes, they have that antigen-antibody complex. These guys are going to come and eat that up, okay? So they're not specialized for anything in particular. They're your cleaners, okay? These are also our presenters. Both the lymphocyte and the monocyte grab onto antigens that don't belong, and they present them to the white blood cells. Now, if these guys are high in percent, we would find that their differential count usually just means virus. Okay, maybe some other inflammations in there, but this one, if it's just the monocytes that's high and not your lymphocyte, then we know we're looking at a virus of some kind. Okay, so that's how you do this. Now, what we're going to be doing for a lab on this is actually doing a white blood cell count. So you get just a one slide, and you're going to have hundreds of white blood cells you got to look through, okay? Probably about 250 or so. And so what you do is you just make little tallies along the way. This is a monocyte. Here's a lymphocyte. Here's an eosinophil. Here's, and you just kind of keep on going with all your fills and all your sites. You just keep a tally of how many of each of those you have. You count up everything that you had, and then you break down by percent. Okay, out of all the white blood cells that are present here, what percent is this, what percent is this, and what percent is this? And that's what we do when we're trying to figure out and diagnose based off of a white blood cell count. Hematocrit, if you remember, was just spinning the blood and looking to see how thick is your white blood cell layer. And then they dive into it deeper and say, okay, they look at the blood cells themselves, they count them all up, and they run their differential counts, and they see, which one is high, and we can make our diagnosis from that. So that concludes the first two items from our assays. We're going to come back, and we're going to talk about blood typing. We're going to take a look at what goes on with that in terms of antigens and antibodies. We're going to take a look at the sphygmomanometer, your blood pressure cuff, and then we're going to take a look at our last topic, which is looking at the other aspect of the blood and just having basically the heart health. And we're looking at the electrical stimulus to fire that. That's our EKG and ECG.